Hi, this is Dr. Antolak from theGentlDentist.com in Shelby Township, Michigan. I would like to discuss dental emergencies. So let's say you are at a baseball game or a football game, for a matter, it's the fall now, and one of your kids get hit, or you see someone who gets hit, and one of their teeth actually pops out. So I have a model here showing your front teeth and your back teeth. Most of the time, if someone gets hit, it's going to break a part of that tooth off, and so it's an emergency, but there's different levels of emergency. So if they knock off a portion of the tooth, then try to recover that tooth and bring it with you to your visit, because many times what we can do is we can literally glue or bond on that segment of the tooth to the other natural tooth, and it works very well. It's actually very conservative, and if there's enough of that tooth available, we can make it look pretty darn decent, and it's a pretty simple process. The next level of emergency is if you chip off a tooth and it gets into the nerve of the tooth. In a case like that, we're going to need to probably remove the nerve out of that tooth, and then restore that with either put this section on or possibly a crown or a cap after that, or even a filling, depending on the age of the child or the adult. And then the worst part is what's called an avulsion. There's a couple different types of avulsions. Avulsion is where it starts to actually come out. So if, let's say, this is the person or loose, the tooth is loose like this, you always want to do the best you can to actually insert the tooth right back into the socket the best you can. The longer you wait for that to take place, the worse it is, because what will happen is you'll start developing, as you see, like a shape of a tooth is like that. In this clot here you'll start to clot up, and so time is of the essence. If an accident like this takes place, you want to try to get into a dentist within a half an hour. It's the best time to do, or within an hour. But try to get this tooth into its socket in its right orientation, and push it up and do what you have to do to keep that in its location. If there's dirt on it, if you can do something just to maybe possibly rinse that off, don't scrub it. Don't scrub the outside of the tooth, because that has what's called a periodontal ligament, which is like a fibrous layer, elastic layer that can reattach once that tooth's back into that socket. So whether it's a partial avulsion like that, try to get it back into the mouth and put it in there. If it falls out all the way, find it, rinse it off. If you have milk, dip it in milk, clean it off that way. You could even have the child, the person who has, they can actually, it sounds gross, but they can try to lick off the stuff to keep it clean, because saliva, their own saliva, is not going to be damaging to their tooth. Okay, so they can do that if they had to, and then once again try to reoriented that tooth back into where it goes. If you have a question about its orientation, what you want to do is notice which tooth it is. So let's say it's this tooth on this person's left-hand side, and you see what it looks like. Go to the other side of the mouth. So you want to look at symmetry. So you're going to go over here to this side here and just kind of look to see what it looks like. Kind of match up what that looks like, the tooth, and then go ahead and do your best you can to insert that into that socket the best you can, and then get your way to a dentist, emergency dentist. If this is the situation, you got to get out of here right now and get to the dentist. If you do need a dental home and don't have that, if we're available, our number is 586-247-3500. If we're not in the office, I do have my cell phone. That's the emergency line. It'll be right on that number as you call it. So please, if you do need to get a hold of it, just give us a call and we'll get you in right away if we can. So try doing these things to help prevent it. Of course, the best way to prevent it is by using mouth guards. If you're doing sporting activities, use full coverage mouth guards, which will really help to protect your mouth and your teeth. Thank you, and hopefully you're not having an emergency, but if you are, get to the office right away. Thank you.